Portage County Economic Response Team's Economic Recovery Briefing, recorded Wednesday, May 13, 2020.
Well, we'll get started. Welcome, everybody. I think this is our fifth call. I'm not exactly sure. We're almost into the second hand, so that's I guess that's a good thing, even though we'd like to see things differently. But welcome. We've been doing these weekly now, the Economic Recovery Briefing, the Portage County Economic Recovery Team. You can see our logos around the, well, I guess on the previous screen, I'm sorry. But on this, there we go, on that screen, you can see the logos of all the folks that are involved with this group as we're looking forward to economic recovery as we get through this health crisis. And Ryan, if you wouldn't mind flipping to the next slide, then this kind of shows what we're up to today. We have the Department of Workforce Development, the Secretary from the state of Wisconsin, Caleb Frostman will be on. And then we're going to have a local regional healthcare perspective from Bob Smith, who's the Vice President at Aspirus here in Stevens Point. So we're glad to have both of you on as guests. Just a reminder that this is taped and it will be posted probably within the next 24 hours or so after this. So if you want to share it with somebody else or you want to go back and listen to it again, that's certainly there, or get some notes off the slides, whatever. We do want to remind people, we had our census committee met this morning. We want to remind people that even in the middle of all this, the census still is going on. So if you haven't taken care of that and gone on to the census.gov to complete that, please get on, and that's important as we look at things like economic recovery assistance perhaps down the road and other assistance from the federal government. So make sure you're promoting that at your workplace. Make sure you're getting that information out, sharing on social media, whatever you need to do. As you can see on the top of this page, our website, portageeconrecovery.org. A lot of great resources on a lot of great things out there. So make sure you're checking out that website. And I think with that, let's get right into Caleb Frostman. Again, Caleb is the Secretary from the state of Wisconsin for the Department of Workforce Development. So Caleb, we'll turn it over to you. Thanks for being with us.
Yeah, well, thanks for having me. I appreciate the opportunity to share some updates from our department. And I'm sure, as all of you have seen, it's been an incredibly extraordinary volume of claims the last 8 to 10 weeks since about mid-March. Just for some initial perspective, the 3 weeks prior to COVID-19, we were averaging about 45,000 weekly claims per week. These last 3 weeks, we've been at 340,000 claims per week, and that's happened in a matter of 8, 9, or 10 weeks, which is pretty unprecedented, and it's something like we've never seen before. The numbers we're seeing as far as claim volume, as far as call volume, I think our highest week of claims is more than twice as high as the highest week in the Great Recession. And so we're working really hard to add capacity and whether that's personnel or IT to address this incredible volume of folks looking for help. And I'm sure, as a lot of you probably know this, but if there are people on the call helping those that are looking to file or are going to file, of course, the main thrust of unemployment insurance is those that are out of work through no fault of their own. That's the main litmus test for eligibility. So we've been advising folks, if you're unsure if you're eligible, to apply and to please do so online. That's the best way to get that done at dwd.wisconsin.gov/UI. Our base benefit system is 50 years old and very difficult to update. However, our online claimants portal has been updated, and that luckily has performed admirably throughout this. So online applications are the best way to go. But we've been, since day one, shuffling people from our own agency into unemployment insurance, as well as taking transfers from within state government. We've been working through recruitments for about 300 external hires, and we've signed one contract and are close to signing 3 more for external vendors to staff up between 1,200 and 1,300 additional people on top of our 500-person UI staff. And so that's been people on the phones, in the mailroom, and also adjudicators to help determine eligibility and clear those backlogs. And doing this all also while onboarding 3 new federal programs, the first of which we've been paying for about 2.5 weeks now, which is the Federal Pandemic Unemployment Compensation, which is an additional $600 a week that most folks have heard about. That's for anyone eligible for even $1 of unemployment insurance. So if you're on partial UI, or if you get PUA, or if you're on a work share program, if you're getting those dollars, you get what we call FPUC. And then late last week, that's also backdatable. So late last week, we paid back pay to all approved applicants, totaling $490 million. That's a federal program. So we made about 580,000 payments last week, or 580,000 weeks worth of payments last week to claimants in Wisconsin. And people have been receiving their weekly FPUC for about 2 weeks. And so that's a big chunk of money for people. Like I said, that's backdatable to the passage of the CARES Act. So even if people are in the hopper now and they're not sure if they're going to get, if they're not approved yet, when they get approved, they will be eligible for all their back pay for unemployment insurance and FPUC. So that's kind of what we've been sharing with folks as we've been dealing with this historical claim volume, and folks have been lagging sometimes at getting a determination. We just want to reassure everyone that if you've been filing weekly claims and you are found eligible, you will get all the back pay to which you're entitled, including regular unemployment and/or FPUC. The second program is PUA, which is the Pandemic Unemployment Assistance. That's for people that wouldn't otherwise be eligible for UI, your self-employed, your freelancers, your independent contractors. We started taking applications for that about 3 weeks ago. We've gotten 73,000 applications for PUA. And that particular program, the minimum you can get is $163 a week, the maximum is $370. And again, all of those, if you're deemed eligible for PUA, you will be eligible for FPUC, which is an additional $600 a week. So we're working through that. We're finishing up the testing on PUA. And as I mentioned earlier, one of our biggest constraints in this pandemic has been our technology. Our mainframe benefit system is programmed on a system called COBOL, and all of our changes are linear, and you have to do one change at a time. So we programmed and fixed a glitch in FPUC. We've been programming for PUA after that. So we're hopeful that we can start making determinations and making payments as soon as possible on PUA. And something that we've decided from a policy level is for PUA, we can make determinations of base eligibility a little sooner and a little easier than regular unemployment insurance. So the moment we determine someone's eligible, we will pay them the minimum, which will get them the FPUC. And then as determinations move forward, we can, of course, pay them the additional PUA dollars they're entitled to. But those people obviously need that money sooner rather than later. And so we're happy to make that happen. And then the last federal program we're working to onboard once PUA is set up is the Pandemic Emergency Unemployment Compensation, also known as PEUC. There are way too many acronyms in this world, but PEUC is for the folks that have exhausted their benefits. I should back up and say that PUA is for up to 39 weeks through the end of the year. FPUC goes to the end of July, and then PEUC, I believe, goes to the end of the year, but that's an additional 13 weeks. If folks have exhausted their benefits, they can be eligible for an additional 13 weeks, and those folks would also be eligible for FPUC. So again, if you're eligible for any of those programs, you get the $600 a week. One of the big wins that we've seen in the midst of all these challenges that we're facing. I'm not sure if folks on this call are all that aware of the work share program, but it's a program that allows employers to reduce work hours and then have their employees be eligible for partial UI, and it keeps those employees attached to their benefits. And we passed a package within the last month that expands the program and eligibility. But prior to COVID, we only had one work share program in the state. Since COVID-19 hit, we have over 200 participants or 200 companies in WorkShare with more than 10,000 employees. So that's 10,000 people working partial hours, getting partial wages, getting partial UI, staying attached to their benefits, and getting FPUC. So that's a huge win. We continue to trumpet the merits of WorkShare. Under every scenario that we've looked at, the employee gets more money than they would if they were just obviously laid off. The trust fund gets some relief based on the partial wages, and of course, those employees stay attached to benefits and get their FPUC dollars. So we've been really, among looking for wins in this really, scary, unprecedented time. The WorkShare piece has been a win for us and for the state of Wisconsin. And then, from the staffing perspective, as we do what we can to stabilize our IT system and our phone systems, we've been working hard on the staffing piece. And as I mentioned, we've are in the process of shifting about 20% of our non-UI staff and DWD into UI, which is a huge number. And that's about as much as we can bootstrap. We did the first shift at the end of March. The next one is happening now. We're hopeful. We got about 50 staff from other state agencies. We're hopeful for at least that many more. There's possibilities of that with some of the legislation that was passed in Act 185. The 315 external hires are moving forward. We've had, as of yesterday, 70 offers accepted. Some of those folks have started this week, some start next. But the big ones have been the external vendors. So the big one is a call center that's going to have 500 people. We started training the trainers on Monday. That contract was signed last week. And today, training started for about 70 staff persons in that call center to help walk people through their claims, answer general UI questions, and then triage some of the more difficult, complicated questions back to DWD. But that's a pretty steady on-ramp, and we're hopeful by, I believe, mid-June to have that center fully staffed with 500 people answering phone calls. But the plan right now is, 70 started today. We're hopeful to have between 125 and 200 start next Monday, and similar bumps over the next couple weeks. But that contract's been signed. They're moving forward. The other one that's close, I guess 3 of them are close to being signed, hopefully this week with start dates, hopefully on June 1. One is specific for PUA. We have a vendor that we've worked with in the past, and so we're really close to signing a 40-person call center to help specifically with PUA claims. And just an aside, I guess, as we've been working through this, and I'm sure you probably say the same thing in central Wisconsin, but it's pretty mind-boggling that in 2020, broadband access is still a significant impediment to a huge portion of our state in terms of filing with us, in terms of computer literacy. So the PUA call center, is to relieve some of the pressure off DWD's UI piece, but also to help relieve some of the pressure on the folks that don't have access to either a smartphone or a computer or broadband. So that's been similarly frustrating and enlightening. There's still a lot of work to be done for broadband in Wisconsin, but the other 2 centers that we're hopeful to open on June 1st with contracts being signed here in the next couple of days would be 100 people to just process claims, kind of the backroom work that needs to get done. This is still a pretty paper-intensive process, and a lot of backroom work needs to happen to make sure that these things get processed. And then the last and final center will be a 200-person adjudication center. That's, of course, as we look at determining eligibility with our backlog, adjudicators are one of our most significant pieces to the bottleneck of where we can, expedite these claims. And so we're working, of course, strategically to be smart about which issue families are working on, trying to clear, big groups, whether it's with one employer with a single issue that got missed, or single industries like educators. There are groups that we can clear relatively quickly in large chunks, but there are a lot of them that have additional eligibility that will require some questions to be answered. And so we're working hard and trying to, of course, work with the Department of Labor at the federal level to determine any flexibilities that we can find in terms of determining eligibility sooner, getting dollars out the door. We've had a pretty good working relationship with them. We've not found a lot of avenues there, but we continue to knock and to look and to ask and to pester for the same reasons that I'm sure if you guys are getting calls, I know our legislators are, and we are too, of folks that want to get these things figured out quickly. So we're working diligently on that. And then the last piece is just every time we talk to anyone, whether it's a claimant or a community leader, just the folks that are experiencing this economic anxiety, it's obviously very real. People need to pay bills and put food on the table and buy things like medication. And we just try to reassure everyone that if your claims are filed and you're deemed eligible, you get every dollar you're entitled to. And we'd love for that to have been yesterday, but it's taken some time for us to staff up, even with starting immediately. Especially with hiring within unemployment insurance, there are a lot of security protocols that need to happen with, the fraud piece and all of the personally identifiable information that these employees look at. It's a more rigorous hiring process than a lot of other state agencies and departments. So we're working as fast as we can, and I think we've been pleased to see we've gotten a higher than expected acceptance rate from our candidates. But with those stringent standards, one of the claims specialists, folks will be on the phone. We've had a hard time with people, passing that background check. We're still, over 60%, but that's still, an area that we're looking to figure out how we can, get more of those folks in the door to answer those questions. And I'm sure if you're hearing the same things, so many folks just want to hear a human voice. And I think we've done a lot of work to make our website as robust as possible and informative as possible so folks can answer their own questions. And a lot of people are able to do that. If someone gets their claim in the system in a timely fashion and there are no questions or mistakes, those folks can be approved in 2 or 3 days and paid shortly thereafter. We've been able to pay about 67% of the week's claim thus far, which puts us right with other states. There are others that are way, way worse and some that are slightly better. But just with the volume of claims and the rapidity with which this ramped up, it's been a challenge for all states, including Wisconsin, to get ahead of the hiring curve and get ahead of this backlog. And so just appreciate all of our community leaders out there. I know folks are taking desperate phone calls, as are we, and people are obviously pretty freaked out. And we're hopeful that we can continue to get these claims up the door as fast as possible and do it accurately and efficiently for all the programs, including state UI, PUA, FPUC, and PEUC. So that's a pretty high-level overview. We've got a lot of people working overtime. Our current staff, although it's smaller than we'd like, we're hoping to essentially triple it or almost quadruple it in the next month or 6 weeks. The efficiencies that they've been able to do by working overtime have been pretty mind-blowing. Our adjudicators are 20% up on their productivity. They've been able to get claims triaged 9 months worth in about 5 or 6 weeks. Obviously not fully adjudicated, but they've just been worked to the bone. So I think they're very ready for new staff to start to relieve some of their fatigue. But they've just been outstanding as far as the staff we have in place. But it's obviously just not enough. So we're hopeful, we're optimistic. The signing of the contracts last week, the training starting this week has been a big boom for our staff. We're hopeful to get more of those stood up as the weeks go on here. So that's about all I've got for an update, but I'm happy to answer any questions.
Caleb, thanks so much. It's interesting to get that insider's look at what you're facing, because not only are you supporting a lot of individuals in the state of Wisconsin, but you also have a business that you have to run and you have to hire people and go through a lot of the same steps in different ways that the business community does. So it's interesting to kind of hear that real life perspective of what you have to deal with at the state, besides the fact you're trying to help people as quickly as you can. I have a couple of questions. There's one on the post. If you do have questions and you're on the call, just put something in the post something in the chat room and we'll ask those questions. One of the questions, Caleb, that came up was, looking in your crystal ball, I guess, how is DWD projecting unemployment decreases as businesses reopen? Do you have any sort of a sense, all these people, these massive numbers that are unemployed, any sense of what might happen as we open more and more businesses?
I don't know. I don't have a crystal ball as far as specific numbers, but I will say that, I think as whatever happens with businesses reopening with part of safer at home or whatever the Supreme Court rules and businesses decide to do going forward, I think as long as it's done safely, we're, optimistic that by folks returning to work, we'll see, fewer weekly claims going forward. That won't necessarily, reduce our backlog, but it will reduce the number of claims that we get going forward. And obviously for all the right reasons, like I said, if it's done safely, having people back on the payroll is the best situation for them, for their employer, for their benefits. And so I think a lot of us are, cautiously optimistic for all the reasons, not just for our ability to process claims, but for the benefits of the employees and the employers, that as that ramps up, that those people will, obviously see some economic relief and hopefully, allow us to work through our backlog faster as new claims slow down.
Great. And I will mention that you talked about businesses reopening safely. The WEDC, Wisconsin Economic Development Corporation, WEDC.org, has a reopen plan, some reopen plans out there. They have general guidelines, and then they have, I don't know, it's around 15 different reopening guidelines for individual business sectors as well. So if you're out there on the call or know somebody who's looking to get some ideas, the WEDC website is a great place to go. Another question I had, Caleb, sometimes people, because it's unemployment, it's something maybe new or maybe scary for an individual. It doesn't hurt to apply as long as you're answering the questions honestly and go through the process and you're sharing accurate information. At the end, they're not going to arrest you if you don't qualify for unemployment. It's a tool that you can use to determine if, in fact, you qualify as long as you're honest. That's
exactly right. Yeah, that's a great point. And we've been advising people, that are unsure to err on the side of applying. The worst that can happen, like you said, if you're honest, the information's accurate, the worst that can happen is you're denied. But if you don't apply, you have no chance of getting unemployment relief or FPUC or any of those other programs. So we've absolutely been, our guidance has been, if you're unsure, err on the side of applying. We can determine that as we work through it.
Okay, couple quick things. At the very beginning, you mentioned your website address for people to go to. Can you just run through that real quick?
Yep, dwd.wisconsin.gov/UI is a good place to start. We've got how to file videos on there, really up-to-date FAQs to, for real-time updates that folks continue to ask us. We try to put guidance out there that, makes it easier to file. A lot of our resources are translated into Spanish and Hmong. So I'd really encourage, folks look at that. One of the things that can be most helpful when employees are laid off is to have an employer that's at least familiar with the UI system and can give good guidance as to how folks can apply if they are laid off. So the folks on this call, if you've got some time to familiarize yourself at least with that interface, that can be a great benefit to your employees.
Great, Caleb. And just one last thing, you mentioned the WorkShare program, and that's a program, as I understood it, because this is the first I've heard, is through businesses only. So an individual wouldn't apply for this, but a business could. And what might be the first step or two to get that process started?
Sure, there's an application online that you can fax in. I think you can find it on the UI, that same website, dwd.wisconsin.gov/UI, and I think it might be /UI tax, but you'll find it if you just search our website for WorkShare. But there's an application there, and they've really relaxed some of the regulations around that to try to encourage more businesses to get involved. It used to be the greater of 20 employees or 10% of your staff. Now you can do it as few as 2. It used to be as little as 10% or as many as 50% hour reduction. Now that's 60%. And so they've really expanded that to try to get greater participation. It seems, I don't know if it's correlation or causation, but regardless, we are really encouraged that 10,000 people that wouldn't have otherwise been attached to benefits stay that way. They get UI, they get their wages. So there's pretty robust information on our website and an application there that's pretty easy to fill out.
Great. Thanks so much, Caleb. This is great information. And for those of you on the call, we're going to have the quiz on all those acronyms at the end. So stay tuned. There's some great prizes that the city is going to give out. Thanks for all that. And if you have to head out, we certainly respect that. Otherwise, thanks again, Caleb. And we're going to switch gears now. We're going to have Bob Smith come on the call. Bob is Vice President here with Aspirus in Stevens Point, the Stevens Point campus. Aspirus is a great community partner. And I would also say that the healthcare industry is interesting because obviously you have the frontline people that are helping the patients, the people in their health, but Aspirus is also a business, just like all of us are involved in different forms of businesses. So Bob's going to share his perspective from the Aspirus standpoint. So Bob, the floor is yours. Thanks for being on the call.
You bet, and thanks for having me. I was sitting here listening to Caleb, and I'm thinking about what he's experiences down there in the department is kind of parallel to what we were trying to avoid, that influx, that ginormous wave of work. And as you look at my first slide here, if you can move forward, Ryan, right into that first slide, we in the healthcare industry really tried to take a pause. We saw what was happening out east where this was first starting to hit some of those healthcare systems. So we here, fortunately, have natural social distancing here in the Midwest, and taking a pause in healthcare and gathering insights into what we were learning about COVID-19, what we needed to have on stock or on hand to manage this disease effectively for us. And PPE was one of those critical items. And again, I know this is language and stuff many of you have heard before, but we just didn't have the stock of personal protective equipment to manage these acutely sick patients who have this virus. So it was about us putting a pause on this care, making sure that we had what we needed to safely manage these patients. And then it was changing around our practices. This was a new disease, and we had to do things differently, based off of that limited PPE and type of equipment that was going to be needed for these patients. We had anticipated, and still may see this, a high need for ventilators and anesthesia machines and things like that support a patient's airway. So we were setting up dedicated COVID units. There was HVAC issues that we had to deal with there as well. to put us in a good position of managing that PPE. That also put us in a better position to ensure the safety of our staff and our providers who are praying for those patients. As many of you have heard and continue to see, lab testing was very limited on the front end of this, with only a handful of labs. I think here in the state of Wisconsin, it was just the 2 state labs that run the tests initially, and many labs were very quickly trying to acquire equipment and supplies that were needed to run our own studies, and we did the same. But all around this was creating new policies and processes for this critical situation. We set up our incident command for this virus system, I think the first week of March is when we saw some of this coming, and we were getting the first waves of information from some of this out east. So we got things rolling quite early in trying to manage this with new processes, policies, visitor policies, limitations to that. And then part of our early planning was to say, okay, how are we going to be prepared for a surge of patients? And that was the biggest fear. So when I say parallel to Caleb, that's what I'm alluding to, that surge and influx of patients for us. For Caleb, it's calls and claims and such. So we needed to be better positioned to safely and effectively manage that, because you can't miss on that. Because if you miss on that, then there's going to be harm to our constituents, to our public, to our patients, to our family and community members. And with that surge, not only was it space, but a lot of up-training. When I say up-training, we had providers and staff that needed to learn how to manage a ventilator and how to manage these patients differently than they previously ever managed. So a lot of work on the front end, and that pause was critically important. So I wanted to stress that so people understood why we hit that pause button. Next slide, Ren. So part of that pause was then only caring for the acutely ill. So you can see we just we were taking care of patients that sought healthcare because they critically needed healthcare, and because of that, our business lost 40% to 60% of our normal volumes. Now that varies across our different centers and campuses we've got across our system, but that was because we asked for that. That was also because patients were fearful. We learned very quickly that patients were afraid, and Caleb also spoke about this fear and anxiety as well in his presentation. But we're still dealing with that with patients that are fearful of catching the virus when they come here. Or I spoke to you about that visitor policy. It was frightening, the number of people that had the fear of dying alone, coming into our facility and not being able to have family members around them in those critical situations. So a lot of anxiety was created, a lot of fear with patients in the community over this unknown disease. And then everybody wanted to be tested. Like I said, we didn't have the testing capabilities. There were a lot of limits to this. And we had, I think the first day it went live, we had a line of people here that were requesting to be tested. And so we had to handle those conversations. We had limited supplies, limited capabilities, and really no treatment. So there wasn't anything we could really do with those patients, even if we found out that they were positive. It really was staying at home and practicing the quarantine. Stay-at-home laws then, as we've all talked and as we've all been affected, as Todd alluded to, as businesses here in the community, we've all been affected by the stay-at-home laws and essential workers only. And that impacted us, like I said earlier, that there are a lot of patients that we would normally see that would have been exposed to illnesses and viruses or activities that would put them in a position to seek healthcare. And that wasn't happening. So another reason why we saw such a downward turn of our normal volumes. Next slide, Ryan. So for us, like many of you, we had to make some significant changes. So we're managing to our new volumes. That's the term we're using internally. So we've had to significantly cut salaries and wages for much of our leadership. Unfortunately, a couple of weeks ago, you saw some of this in the media. We had to have some permanent layoffs. Now, we tried, for the most part, to focus these on fixed, non-clinical areas. So keeping the clinical staff somehow engaged, even though our volumes are very low, and keep them as employees. So we have them there. We have that skill there when the patients do start to come back to our facilities. In doing so, some people are put on a furlough. So that allows them to be engaged and a member of our organization, but they're off work for a period of time until we see those volumes bounce back to where we can bring them back. Also had a lot of freezes on our expense spending. So education, construction, building, travel, third party, and all of this has an impact on all of you and everybody we partner with and work on in many of those fronts. Those were all, again, trickle-down effects that we had to put into place and actions we had to take because of our lower volumes. Next slide. So now where we're at today, and that's opening back up for business. So how do you prepare in patients? And I put this on here purposely, customers, because again, for all of you out there, this is customers versus patients, and it's both for us. And this is, I think the bullet points I have here, for the most part, are going to be things that we're all going to have to manage. So we're still managing the fears of people, and Caleb spoke about that. We've got people that are reluctant to leave their homes yet. They're avoiding contact with others. There's been a loss of independence. There's a lot of mistrust out there right now. Different information is flowing out there, and people don't know who to believe and what to do. And then I think on the other side of that, you've got some cynicism as well, right? So you've got people who are poo-pooing this whole process and maybe putting people in an uncomfortable position by, pushing the social distancing envelope, if you will. But what we all need to do is create a sense of safety. And that means practicing the social distancing, having clean areas of business for customers to return to. And that's going to have to be obvious. Customers are going to want to see that we're cleaning right behind them. They're going to be looking around for clutter and dirt and looking at our processes as to how we're handling this. And they're going to be judging us on that. We also need to prepare and keep our staff and employees safe. They're going to be interacting with these customers and these patients. They're going to be performing some of those cleaning duties. So we need to make sure that they're in a good position to be successful and safe in what they're doing. And again, exhibiting the behaviors that we need them to exhibit for people to have confidence in our delivery of whatever service we're delivering to them. And then that just segues into new ways of delivery. We've done this, and I'm sure many of you are looking at other ways in which you deliver your services. We're doing virtual health. We're doing telephone visits. There's other things we're looking at doing as well. And just, myself here in the community, when I go to a store or when I go to the restaurant, you can see all the modifications we're making. And I think the entrepreneurial spirit is live and well out there. You see a lot of creativity with some businesses to keep things open and going. And we're going to have to continue to do that and find new ways to get our services out to our customers. And then being prepared. I've stated this, and I think others have stated this as well. We need to be prepared for an increase of COVID. I think right now we're going through kind of a stabilized period, but we need to be ready. You see it pop every once in a while when this hits a community-based living center or a nursing home or some of these large manufacturing plants where you've got people in close contact. We're going to see little bumps, if you will, on that curve of incidence of COVID. And so we need to have early warning triggers within our own community and with our businesses of identifying when does that happen. And if we can identify those triggers early, how do we nip it in the bud? We've got to have that testing capability and testing capabilities that can be quickly turned around. And then that all allows us to do some contact tracing. It's important for us to be able to test, see who's got it, and then see who they've been in contact with and follow up with testing there as well to, again, try to mitigate and control the spread if we start to see a little bit of a balloon of incidents in a certain area. Next slide. And then just our new reality. Like I said, we may be going through kind of a stabilized period right now, but there's a lot of literature, there's a lot of conversation out there about what does COVID look like this fall. When you look at influenza season coming and such, we don't even know how COVID's going to react during the summer months. So the economy, we're dealing with this fallout, despite, even if COVID remains stable, if you will, for the next several months, I think we're all still going to be reeling from this for a certain period of time. And I think that's months before we kind of get our feet back underneath us and things kind of become or go back to norm, whatever normal is. I don't think it's ever going to be, that's Bob Smith's personal opinion, going to be what it was 3 months ago. But I think the bottom line is we're still learning. This is an unknown disease. These are unknown processes. These are new things we're going to all have to discover ourselves. And one thing to do is keep up with the latest information. So find a good source. here at Aspirus, what we did and what we did early on with incident command was to say, we're going to follow the CDC. So find a primary source you can trust and get your information from there as the source of truth, and follow that information that way. If you bounce around with different sources and different ideals, it can get confusing, it could get frustrating for you, and it'll be difficult for you to manage, I'm certain. Ask questions, seek assistance, lean on people, find new partners. There's a lot of information, there's a lot of individuals here in our community that have knowledge and skills, and it's just amazing what we've already seen with some of the community members stepping forward and supporting even us here in healthcare with the masks and other personal protective equipment, with Portage County Create giving us the face shields. I mean, it's just amazing how quickly people can come up with an idea, pull things together, and execute. And we're going to have to continue doing that, because there's going to be times for that as we go forward. And that's just being prepared. So again, I think all of us as business owners or managers of our businesses need to be prepared. And you've got to think about, what is my next move? What do I need to be prepared for? And what are my mitigation strategies? And then being nimble. Because again, it's going to change, and there's a lot of things to this that are unknown to us as we manage through this and all learn together. So that's my message in a nutshell, and I'll take any questions people may have for me.
Bob, thanks so much. Again, really, interesting information to get some of that behind the scenes reality that you've had to deal with, and the people on the front line have had to deal with in terms of this crisis, and then also just not simple, but the employee part of it as well. One question I want to ask you, and I apologize, I just had a call on this yesterday. Aspirus is rolling out a relatively new program. Is it called Work Well? Is that right? Can you share any nuggets on that?
I can, and I was just reluctant to put it in my slides, Todd. I didn't know if that's something I could toot our horn about, but yeah, we do. So Work Well is a program that we have that we've developed. It was publicized and rolled out last week. It's through our business health division of our organization, and we're opening up to any business. It's a free of charge kind of service that we're providing. Partner with us in our business health division, and we'll advise businesses on how to do this. How do you open your doors back up? How do you put in place some infection prevention processes at your business? How do you keep your employees safe? How do you engage with us or anybody else to have those early warning triggers or testing capabilities or tracings? So there's a lot of information, a lot of knowledge that we've learned that we want to share. Donna Owens is our director of our business health, and she's been out on the road speaking to various groups about this. And if anybody's interested, you can shoot me an email, or you can contact Donna Owens, or go to our website, our business health website on Aspirus, and I believe the link is out there for the Work Well program to see kind of what we're doing. There's a synopsis or an overview summary of some of the services we might be able to offer you.
Great, thanks so much. Well, Bob, we appreciate all that you're doing and all the Aspirus and across all of our healthcare providers in our region. They've been up against it, and fortunately, we haven't seen huge issues here. We hope that'll continue that way. I think, as you said when you were talking, for our own mental health, I think we need to be prepared, though there could be resurgence or anything along those lines. So I think these next 6, 12, 18 months, it's going to be, a little bit of a roller coaster ride for all of us. But I think, again, you said this community really steps up and steps forward. You look at the United Way and the Community Foundation Relief Fund. We've had several $100,000 donated to that, and lots of other great stories as well. You mentioned the PPE and things. So a lot of great things in our community. Bob, any last things you'd like to ask?
Nothing that I have, but again, if people have questions, feel free to reach out to me with an email, a phone call. I welcome anything if I can direct you. I may not have all the answers, but there may be some really smart people here that I can direct you to.
All right, great. Thanks much. One question that popped up, and I guess, Bob, this isn't necessarily for you, but if anybody knows of resources for hand sanitizing and Clorox wipes, I know that that's an important thing as folks are reopening. So if you want to shoot that to Ryan at the city, or shoot it to me, or post it here on the chat box for everybody, we're trying to find it ourselves at the Business Council for whenever we reopen. So Ryan, I'll turn it over to you. Do we have any questions that came up ahead of time, or any other things before I wrap it up?
Nothing in particular, Todd. Thanks to Bob and Secretary Frostman for taking some time today to out of their busy schedules to meet with this group, and we really appreciate them doing that. There's been a lot of conversation, as a lot of folks may recall. Just earlier this week, Executive Order 36 was issued, which really starts paving the way for retailers to start reopening. And I know Todd and through Portage County Business Council has been doing some really excellent promotion and reopening ribbon cuttings. And something that we talked about yesterday was we're going to be looking for some of the best practices that businesses are implementing at their storefronts to promote and help gain consumer confidence that it's safe to go to these stores and to shop there and to spend some time with our local businesses and spending some money with them as well. So that's one thing that we're doing. We're really trying to promote that, especially on the local level. And that's really where we're at from the county's economic response team. Nothing in particular that came in that we didn't cover on our questions today, Todd. So if you have anything else, that's all I have from the city.
Just one quick point. I know we're all waiting for the Supreme Court ruling. I want to also, again, I keep giving this caution out that once they make their ruling, that most likely will not mean that all of a sudden everything's wide open, everybody should rush back to work, everything's back to where it was. They're going to provide a ruling that probably, most likely, will dictate to the state government, the governor and the legislature, to come up with any sort of changes to the plan. Right now, we're still going by the May 26th plan. And of course, as Ryan mentioned, we did have some opening with some of the retail. So we're still sticking by those rules. But when you do hear that Supreme Court ruling, read it and listen to it carefully, because chances are it's going to ask the legislature and governor to come up with some sort of a solution. Next week, we know we're going to have, we're pretty sure we're going to have Gary Garski on from County Health, talk about some of the numbers and changes and the green and yellow and red lights in terms of the health of our community, the health of our county. We're also talking about a couple other possibilities as well. We'll have that out by Friday or Monday. Keep your eyes open for that. The website's on there again for other resources. We certainly appreciate everybody being on the call, and have a great week, folks. Thanks very much.
Thank you.